If you watched my video on Tuskegee, you already know this man's name. You just don't know it yet. Dr. John Cutler spent decades of his career working for the United States Public Health Service. He was one of the researchers behind the Tuskegee Study, the men left to suffer with syphilis for 40 years while their government watched and did nothing. But 4 years before Tuskegee's exposure would even begin to be questioned, Cutler was already somewhere else, doing something his own colleagues would later call arguably worse. In Guatemala, between 1946 and 1948, John Cutler deliberately infected more than 5,000 people with syphilis and gonorrhea: prisoners, soldiers, psychiatric patients. People who had no disease at all until his research team gave it to them on purpose. It was never published. It was buried for 64 years. It was only found by accident, by a historian who was looking for something else entirely. To understand how this happened, you have to understand what was happening back home in America. By the mid-1940s, penicillin had proven itself as a genuine cure for syphilis, fast, effective, and increasingly available. But Cutler and his colleagues at the U.S. Public Health Service had a follow-up question that mattered enormously to a country about to demobilize hundreds of thousands of soldiers back into civilian life. Curing syphilis after infection was one problem solved. Preventing infection in the first place, through a fast-acting chemical treatment applied immediately after exposure, was the next one they wanted to answer. To answer it, they needed something specific and difficult to obtain ethically. They needed people who did not yet have the disease, exposed to it under controlled conditions, so researchers could test whether a preventive treatment actually worked. In the United States, this kind of study, deliberately exposing prisoners to sexually transmitted infection using paid sex workers, had recently become legally and politically untenable. Reforms in the years just before had shut that door. So the Public Health Service went looking for a country where the door was still open. Guatemala, at the time, had a government willing to cooperate closely with American medical researchers and institutions, a national prison, an army barracks, the country's only psychiatric hospital, a national orphanage where oversight was thin and the people inside them had almost no ability to refuse anything asked of them. Cutler was sent to run it. The initial method was, in its own clinical language, called normal exposure. Researchers arranged for commercial sex workers already infected with syphilis or gonorrhea to be brought to imprisoned men under the pretense of ordinary visitation. The men were not told why these visits were being arranged, or that the women had been selected specifically because they carried a disease the men did not yet have. It did not work reliably enough for the researchers' purposes. Natural exposure through this method was inconsistent. Some men never contracted the disease at all, which was a problem for a study that needed guaranteed infection to test a guaranteed prevention. So Cutler's team changed methods. They began direct inoculation, introducing infectious material, cultivated from human and animal sources, directly onto abraded skin or through injection, bypassing the uncertainty of natural exposure entirely. At the National Psychiatric Hospital, patients who had no ability to meaningfully consent to anything were infected this way. At the Army barracks, soldiers were infected without being told what was actually happening to them. Even at the National Orphanage, children were not deliberately given the disease itself, but were used for repeated blood testing as part of the broader research effort. Every subject was, at least officially, meant to be treated with penicillin once infection was confirmed. Whether they actually received an adequate dose, enough to be genuinely cured, and not merely treated in a way that satisfied a research checklist, remains, to this day, unclear for a significant number of the people involved. Most of the more than 5,000 people swept into this research exist today only as case numbers in a research archive. One woman does not. Her name, as recorded in Cutler's own case files, was Berta. She was a patient at Guatemala's National Psychiatric Hospital, already vulnerable in every way that mattered, already without the ability to refuse what was being done to her. Cutler's own written records describe infecting her with syphilis, then, when her condition didn't develop the way his research required, deliberately reinfecting her again and again. His notes describe her declining sharply. She was physically deteriorating in ways his own writing does not fully explain, in the clipped, procedural language researchers use when they have stopped thinking of a person as a person. Several days later, according to Cutler's own documentation, Berta died. Her death is recorded in the surviving paperwork, the same way everything else in this study was recorded, as data, as an outcome. as one line in a research file that nobody outside a small circle of scientists was ever meant to read. She was not the only person who suffered permanent harm in this study. She may be the clearest single reason it needed to stay hidden. Unlike Tuskegee, which ran openly for 40 years, published in medical journals, discussed at conferences, hiding in plain sight, the Guatemala experiments were never published anywhere. Cutler simply stopped. The study ended in 1948, its results deemed too unreliable and too methodologically compromised to be worth releasing. The full record of what had actually been done to more than 5,000 people went into storage, and there it might have stayed forever. Cutler went on to build a long, celebrated academic career at the University of Pittsburgh, remembered by colleagues and students as a dedicated, deeply engaged professor of international and reproductive health. Late in his life, he donated his personal papers, decades of research documents, including the complete Guatemala files, to the university's archive. He restricted access, allowing it only, in his own instruction, to serious researchers. He kept the evidence. He simply made sure almost nobody would ever look at it. In 2005, a historian named Susan Reverby was doing something that had nothing to do with Guatemala at all. She was researching the Tuskegee Study, the same study Cutler had also worked on, when she came across his name in an entirely different context, buried inside his own donated archive. She kept reading. What she found took years to fully piece together. It was not published until 2010, and when it finally reached the public, the reaction was immediate. In October 2010, the United States government did something it had never fully done for Tuskegee in the same way. It apologized quickly, and it apologized specifically. Secretary of State Hillary Clinton and Health Secretary Kathleen Sebelius issued a joint statement calling the research reprehensible. President Obama personally called the President of Guatemala to apologize directly, government to government. A presidential commission on bioethics was convened. Its formal conclusion was blunt. This research could never have been ethically conducted, under any standard, in any era. Here is where this story becomes something more complicated than a simple villain narrative, and I want to sit with that honestly, rather than flatten it. Cutler was not, by every account of people who actually knew him, a cartoonish monster. He was, by most descriptions, a dedicated public health researcher who spent his entire career trying to defeat a disease that had killed and disabled people for centuries. Blindness, insanity, and death were all genuine, well-documented consequences of untreated syphilis at the time. His stated goal, a reliable way to prevent infection entirely, protecting soldiers and civilians alike, was not, in itself, an unreasonable thing for a public health researcher of that era to want to solve. But look at exactly who was chosen to bear the cost of answering that question. Not American citizens with legal protections, not university volunteers who could refuse and walk away, prisoners in a foreign country, patients in an asylum with no capacity to consent, soldiers under orders, children in an orphanage. The same pattern that ran through Tuskegee, choosing the people least able to say no, least likely to be believed if they tried, did not stay in Alabama. It followed Cutler to Guatemala, and when the reforms of his own country finally closed one door, he simply found a government willing to open another. 15 years after that apology, meaningful financial compensation for victims and their families has still, largely, not materialized. Lawsuits filed against the institutions connected to the funding of this research have mostly been dismissed on legal technicalities. The apology was fast, the accountability was not. John Cutler died in 2003. He was never criminally charged for Tuskegee. He was never criminally charged for Guatemala. He died a respected, retired professor, remembered by his own university as beloved. One man. Two of the most notorious human experimentation scandals in modern American history, and a career that ended in comfortable retirement, celebrated by the institution that had, for decades, quietly held the evidence of what he had done. Here is what I keep coming back to. It was never one uniquely evil person operating alone in the shadows. It was a system funding, institutional cooperation, willing foreign governments, archives that could be sealed for as long as someone wanted them sealed that made it possible for the same man to do this twice, in two different countries, separated by an ocean and a language, and face no real consequence either time. The victims of Tuskegee were men who trusted their own government. The victims of Guatemala were people who never had the standing, in Cutler's eyes, to be worth asking at all. Both groups were chosen for the exact same reason. They were the people least likely to ever be believed if they told someone what had happened to them. This has been Hollow Cure. You just watched the same man run two of the darkest medical experiments in modern history and die celebrated for it. If that thought stays with you, if you're wondering how many more names like his are still sitting quietly in an archive somewhere, waiting for someone to look, subscribe, because we are not done.